prosperity. It is therefore encouraging to witness this initiative. We view it as a significant intervention that will not only expand healthcare delivery but also emphasize preventive care, community outreach, and early detection of diseases. Critical elements in reducing the burden on our health facility and improving overall health outcomes. We are particularly pleased with the focus on equity in distribution of health resources. As traditional leaders, we remain committed to supporting policies and programs that promote fairness, inclusiveness, and social justice within our communities. Your Excellency, the success of this initiative will depend not only on policy directions but also on effective collaboration. In this regard, the National House of Chiefs assures government of our unwavering support. We stand ready to partner with all stakeholders to mobilize our communities, promote public awareness, and ensure the smooth implementation of this program at the grassroots level. We will continue to use our platform to encourage our people to embrace preventive healthcare practices, patronize health facilities, and support health professionals in their noble service to the nation. Let me also take this opportunity to commend the Ministry of Health and all partners whose dedication and hard work have made this initiative a reality. Your effort reflects a clear commitment to improving the quality of life for all Ghanaians. In conclusion, Your Excellency, NANANOMO fully support this visionary initiative and express our confidence in its potential to transform healthcare delivery in Ghana. We remain resolute in our collective responsibility to contribute to national development and to the well-being of our people. May this initiative succeed and leave a lasting legacy for the generation to come. I thank you all for your kind attention. Thank you.
Thank you, Dasibre, for those wise and dignified reflections. Mr. President, distinguished guests, ladies and gentlemen, our next speaker leads the sector at the heart of today's program. Please join me in welcoming the Minister for Health and the Honorable Member of Parliament for Dwabosu, the Honorable Kwabena Minta Akando, to deliver his statement.
Thank you very much, Kafui. Your Excellency, the President of the Republic of Ghana, President John Dramani Mahama, the Honorable Regional Minister, our host, the Government Chair, the representative of the National House of Chiefs, the representative of the Regional House of Chiefs, my colleague ministers here present, our partners, the heads of agencies, NIME, NAME, NANANOM, distinguished ladies and gentlemen, good morning. It is a great honor to have you join us today for a landmark moment in the transformation of Ghana's health system. Your Excellency, permit me to begin by acknowledging your sustained commitment to healthcare in Ghana. From your early support to the expansion of CHIEFS during your first tenure as President, to your leadership in advancing initiatives such as Onuador program, to your consistent investment in equipping our health facilities across the country. Your dedication to strengthening health delivery systems has been clear and deliberate. In this administration, Your Excellency, you have once again demonstrated bold leadership, most notably by the uncapping of the National Health Insurance Scheme a decisive move that created physical space for transformative policies such as free primary health care and the Ghana Medical Trust Fund, aptly known as Mahama Cares. Beyond our borders, you have also been leading advocacy for health sovereignty, championing Africa's ability to finance, produce, and sustain its own health system. Mr. President, today's launch is a direct reflection of that vision, that commitment, and that leadership. We are fortunate to have you as Ghana's President, sir. Your Excellency, ladies and gentlemen, global evidence is clear. Primary health care is the most effective pathway to achieving universal health coverage. The World Health Organization estimates that scaling up primary health care could save up to 60 million lives worldwide by 2030. Countries such as Thailand, Brazil, and Rwanda achieved universal health coverage by making a deliberate, decisive decision to invest first in primary health care. Ghana has made significant progress over the years. We have expanded CHIPS, introduced the National Health Insurance Scheme, and improved key health outcomes. But we must also be honest with ourselves. Out-of-pocket expenditure remains high at around 35% of total health spending. Many Ghanaians still delay seeking care, and non-communicable diseases are rising rapidly. Too many of our people enter the health system late when conditions are worse, severe, treatment is more costly, and outcomes are worse. Your Excellency, this is why this initiative is transformational. This reform will deliver, first and foremost, financial protection. Primary health care services within the defined package will now be free at the point of use for all Ghanaians. Additionally, we will use this opportunity to encourage all uninsured people to enroll on the National Health Insurance Scheme. This will enable them to access care at district, regional, and tertiary hospitals, as well as more advanced primary health care services not included in the free primary health care package. Second, it marks a decisive shift towards prevention. Routine screening, early diagnosis, and proactive community outreach will become standard practice and not occasional interventions. Third, it ensures integrated and equitable care delivery. CHIPS compounds, health centers, and polyclinics will be linked into a seamless system that will improve continuity of care, efficiency, and outcomes. And fourth, it represents a fundamental financing reform, moving us towards paying for health and prevention, not just for ill and treatment. In other words, we are moving from sick care to health care. Your Excellency, by 2030, we expect to see out-of-pocket expenditure fall below 20%, to see over 95% of Ghanaians accessing essential primary health care services, to see reduced congestions at our hospitals, and to see a stronger, more resilient health system. This is how countries achieve universal health coverage, and this is how Ghana will achieve it. Mr. President, I am pleased to report that we are ready. We have completed the costing and financing frameworks. We have initiated the necessary legislative reforms. We have strengthened coordination across the Ministry of Health, the Ghana Health Service, the Christian Health Assistance Authority, and our partners. We have procured over 24,000 pieces of essential medical equipment, including incubators, glucometers, hospital beds, and ultrasound machines to support services delivery across the country. We are advancing digital health systems to ensure transparency, monitoring, and accountability. Over the next 2 months, Ghanaians will begin to see this transformation in full action. We will distribute equipment to all 150 districts that will be part of the first phase of the implementation. We will intensify community sensitization through town halls and engagements. We will deploy trained volunteers to support our community health workforce. And we will establish over 350 container-based service delivery points in high-traffic areas with mobile populations such as market and lorry parks. Very soon, health workers and volunteers will not only be waiting at the facilities, they will be in our homes, our schools, churches, workplace, screening, educating, and supporting us to stay healthy. Ladies and gentlemen, let me end with a simple reflection. Many of us here have at one point or the other organized health screening exercises in our communities. Eye screening, blood pressure checks, diabetes testing, HIV outreach programs, to name a few. We have done so because we understand the value of early detection. We have seen the lives that can be saved when people know their health status early. Although these efforts are commendable, they have often been sporadic, reliant on individual initiatives, and limited in reach. What this initiative does is fundamentally different. It institutionalizes prevention, it mainstreams screening and early detection into everyday functioning of our health system. It ensures that the preventive care is no longer occasional but continuous, accessible, and universal. This is the transformation we are launching today. From late treatment to early detection, from out-of-pocket burden to financial protection, for your leadership, Mr. President. Thank you all for joining us on this historic occasion. I'm most grateful.
Thank you very much, Honorable Minister, for that clear and purposeful statement. Mr. President, distinguished guests, ladies and gentlemen, we now take a brief interlude. This will be a drama presentation by the Creative Arts Foundation. To our viewers joining us live across GTV, GH1 TV, Metro TV, Channel 1 TV, Wazor TV, MOH TV, and digital platforms, stay with us because this performance reflects the real human stories behind access to healthcare. Please welcome, with a big round of applause, the Creative Arts Foundation.
I get some credit. Huh? Mati wati sawa bowa sa say kwankwan say den ada wo de besami ana adia samfun kura no maka chota kwa yar sabia ko sa ho yare
hospital too expensive the board the door
say ya na o kan ya kana no wuya wuo no what na wa ka wuya wuo
Mama, stop that. Kora no oyo kora. Me ankasa me ba. My son. Menyam kakaduro pregese ginger ni garlic. Well, me misimanu one dot pa. Cough no.
And what na wasa wanye. And obewu.
Amen.
Amen. Why abramo?
Good afternoon. Welcome.
Thank you.
Hey. Akwabo.
I'm here with a good news, a very good news for all of us. We now have a free primary health care service available in our community. It's free. I'm a veteran. Well, the government has a new initiative, which is the primary free health care for our community. So we are asked to go around to educate the people. Oh, please, since you are here, I will hand over to you.
No, you go ahead. I'll assist you.
Thank you so much. Yes, please, I did. And it's actually very free for everybody.
What's it? Are you free?
Are you free? Are you free?
Wow.
It's totally free for our cheap compounds, health posts, and health centers all over in our communities.
For all Ghanaians.
For all Ghanaians.
Free? For real?
It's free.
So you mean Ghana for free?
Ghana is not free, but the services are completely free.
Oh, stop that.
Oh, I'm not joking with poor people. I am very, very serious, and I'm not joking with poor people. This is from our own very president, His Excellency John Dramani Mahama. It's very free, and our services include blood pressure tests, blood sugar testing, BNI assessments, mental health screening, and most importantly, breast cancer screening.
Hey! Breast cancer, Ghanaian.
But try.
So can you check whether she loves me?
Oh, and it dear, just a prayer compo, and it just a prayer camp, but so.
Asoma wo kana ko wanu. Ha? Mempewa e ka me note.
Ekwa mama enchin ko ama no me chinsa we dey ngan enchin.
Enwan we dia ma wafu aye fa je ba sare ban. Come here kwajo no.
Your pressure is so high.
It's because of my father. My father. Your father where? When you eat and drink and sleep like a retired lion.
It is very important we go for early screening. Early screening saves life, even when you feel fine.
Madam, so it means who need national health insurance? Free?
But so you feel bit in your boat with you, we are a boy registration. And say you're free. But so bit in your
Hey!
And me for him screening to see. I'm also going to check. Madam, let's come, let's go.
Mira, me kwa koshe. Yesi adia yedi ani ehu no. E de di ho adanse. Eti me kwa hwehwe ye no kura na so wo mu twa ye ntora.
Wo check bra.
Me kwa ba.
Na wo kwa hwe ni o hwe ni.
Wo kwa kwaju wafu no.
Beko na wo kwa na hwe ni mpa cho. Obi afra manko. Things are nothing things. With the I have some power to some friend auntie. Hello. I tell you again. Ataju yatido yatide. Dabe nyemu bonu de message no nyabo se na eche na meka no. Ya meka no eche momo kra. Aban the important ehihye bia ba. E fa free primary health care. What did I say? No, free primary health care. And what you say? Apart from chips compound in the polyclinics near the idea, we bet you go check your blood, your sugar, your BP, the cholesterol near the idea free. No, almost like the health post, about community BM, and me na free. Uko about checking free. Ujate kukura. Mr. Ujate ku. I attack you. Mr. Atide. It is the thing. You will move from sick care to health care. Sick care to health care. I just say, young chairman, we are and Sunday Asano. You saw Ayarino and Sana Wayari. If it's a prevention, is better than cure. What did I say? It would have been told Momo, no second way, that's just my Baba Abel from how far. Hey, Namukoye. Todo. I had to pay. I'll buy a papa. Hey, free. No excuse.
And you're grown.
Me say, Mahama, Mama, Onampo, Onampo, me quiet. I no crack through. Matake free. Hey, Makacha woman says, me the why you crying. Just on me home for one and I said, this one panome. And yes, sir, remember what they be able to check it. Miss Now, quite you funo, what funo? Aha.
Miss, they say the BBI you free. You call ye on my check you BBI you free. And the baby I will be no. They say, oh, you free. On to me, but also to me here. On more points, various points in the box that I post on corner. BBI you free.
Mese, inkaninte, minjonim bipe,
na ba check a check me fair free o mi pa bo fai bon ya na check bo o champagne ani mo fia wan yo se o na nyu me na me mo fia wan yo se nke mahama ni e bo na o he ngona npa
metla de free na da wo humbozi ala sapa ho who is the chenga that's it to top ho before check la de free hey mama policy Mahama
ya de woka
Mahama
hey what the
yo bra Mahama mediuka
yo munsama
yo mbao
Thank you, Creative Arts Foundation. We now have the Ghana Dance Ensemble National Theatre performing the Takai dance. Thank you very much, Ghana Dance Ensemble National Theatre with the vibrant Takai dance. Ladies and gentlemen, before the President addresses us, we'll be treated to a rich expression of our culture. Please welcome the Dodowa Forest Talking Drums as they present drum appellations in honor of our special guest of honor.
Neneme, naname, amlalom ni kotomai, hiyo chali, ni hewike yewi, ni hemanye. Sebi ne waheke hanye yiji, mohe. Imi asleti o ibieji, alwa Laurentia dede bake ajano. Imi hilo bieji eche Isaac dugbate ayihi. Ikpanyepe nye gbatwe manewo. Mohe, mohe, mohe. Your Excellency John Dramani Mahama, mohe. Mohe kebase osudoku. Sema chuo hamo babae. Osudoku machuo hamo babae. Wake na boe. O bake. Your Excellency. Ghana wabwajo wahe saminya. O bake ni makake. Se wahemo ke nima enyo. Nima enyo.
Mweno ohane wabwajo wa esaminya. Ejakan ilevi mafokese zumi. Betting tax pay tako pie. Ne dollar ba wo mayo nge dodo ahwechi wo mi. Ebusi blue. Modene onge bonge hiocha mi ke hewa minami hiyo. Gana bewura. Ayeko. Your Excellency. Wake ayeko. Omampenyi. Yamawumo. Mo ni ejumapa. Gana bewura. Amaraba. Wabwa henyanga hiyo. Wangamo babae ha. Wabwa jowa he saminya. Your Excellency. Nyumungwa. Besu ne wamanu osegbi papa. Gana bewura. Nye hesibami. Wo ohenu. Banite boy. Nye bleu. Nyumukate. Ejumaura. The great warrior. Wo obi. Fia manyeneba. Fia manyeneba.
So you are done. Kindly be seated. Thank you very much. The sun is not easy this morning, so we'll get this over as quickly as possible so that we can go catch some rest. Let me acknowledge our chiefs, Dasebre Kwebwe-Wusi, representing the National House of Chiefs, Nana Tete Waka III, Vice President of the Greater House of Chiefs, Greater Accra House of Chiefs, King Taki Teko Churu III, Mancha Empowerment Chief of the Traditional Area, and indeed so many chiefs, Manfihini. I can see so many of you, most of you are very good friends. Let me welcome all chiefs and queen mothers present here this morning. The Minister for Health, the Honorable Kwabna Minta Akando. For those of you who don't know, he's called Akwadanyame because of the things he's doing in the health sector. The Greater Accra Regional Minister, Honorable Linda Oklu, and for those of you who don't know too, she's called the Demolition Woman. The Member of Council of State, Nene Drolo Boso Odamte, Senior Government Officials, Chairpersons and members of the National Health Insurance Scheme, revered clergy and imams, members of the Diplomatic Corps, board members and management of health agencies and staff of the Ministry of Health, key stakeholders, distinguished ladies and gentlemen, friends of the media, and everybody present here. The Minister has spoken at length, and I think that his is the keynote address because he's really explained what the free primary health care is about. So I'm not going to read a speech. I was giving a prepared speech, but I'll just emphasize a few aspects of what he said. In the first place, I'm happy that we're launching it here at the Shai Osudoku District Hospital. For those of you who don't remember, 10 years ago, on 4th April, in my former incarnation as president, I commissioned this hospital. And I'm happy to note
that the hospital is still doing very well. It is one of the best kept hospitals. The CEO is here. Aiko is one of the best kept hospitals, and it has gained global fame beyond the borders of Ghana. It won consecutively Safe Motherhood, Zero Maternal Mortality and Infant Mortality for several years. And so, because of their reputation, they are victims of their own success. People come from outside their catchment area, from as far as Eastern region, to come and either deliver here or seek medical assistance here. So to all the staff, I say Aiko for the great work you're doing, medical director and all your staff, Aiko, well done. We hope you continue to maintain the standard that you have, and we hope that all health facilities in Ghana will come and emulate the example that you have set. Now, I just want to emphasize the importance of the free primary health care. We've been talking about universal health coverage. Every country is working to achieve universal health coverage. And universal health coverage is the situation where every citizen has access to quality, affordable care. In Ghana, we introduced the National Health Insurance Scheme, and it expanded coverage and affordability in a major way. But since we introduced the National Health Insurance Scheme, we still have a lot of pockets of underserved areas, especially in the rural areas. And so, for countries that want to extend the reach so that they can achieve universal health coverage, they include in it the primary health care aspect of it. With the health scheme, normally for most of the health facilities under the health scheme, you see the patient only when they are sick. And so, it's mostly curative. One key aspect of the free primary health care is preventive, to identify the illness and get early treatment before it develops into something else. And so a major part of the free primary health care is the health screening aspect. And we are encouraging that when we roll out the free primary health care, our traditional leaders and our religious leaders will help us to mobilize their communities. At least every Ghanaian must be screened once a year. Every Ghanaian must be screened once a year. And you get the basic screening, and that includes hypertension. So the free primary health care post would have the sphygmanometers so that they can check your blood pressure to see if you are developing blood pressure. Sometimes if you are developing blood pressure, just a change of your diet can take it away. A change of lifestyle can take it away. But if your blood pressure is high and you require treatment, then you will be referred up to the district hospital level. So the free primary health care complements the national health insurance. And so at that level, it's free of charge. You go, the screening, everything is free of charge. If it's a basic illness like malaria, your CHIPS compound will have the medication for malaria. If it's a basic illness like cholera, your health compound, CHIPS compound, or your health kiosk will have the basic drugs for you. If it is a respiratory illness that requires cough mixture or something, you get it at your CHIPS compound. But if they take your blood sugar and your blood sugar is high, you can change it with diet, but if it persists, then they will have to refer you to the district level. And at the district level, you use your national health insurance card to get the treatment and the drugs that you require. So the free primary health care is complementary to the national health insurance. It's not coming to replace it. It is coming to complement the national health insurance. So it doesn't mean that because the free primary health care has come, you shouldn't get a national health insurance card. You should still have a national health insurance card. But at the point of examination and treatment at the polyclinic level, at the health center level, at the CHIPS compound level, at the health kiosk level, you don't need your NHIS card at that point. You just need your Ghana card or any form of identification to show that you are a Ghanaian and you are resident in that community to be able to access health care. So that's how it's going to operate. Now there's another layer that we have introduced above the national health insurance. Let's assume that we discover that you have high blood pressure or diabetes, and you get the early stages of kidney failure, renal failure. They notice it at the free healthcare center. They'll refer you to the district hospital. You go to the district hospital. You use your NHIS card. Now, if your illness is advanced and you need dialysis, there might not be dialysis machines in your district hospital. So that's where you'll be referred to the third aspect of it, which is the Ghana Medical Trust Fund. That's the Mahama Cares. And so you will apply to Mahama Cares. You'll be referred to a kidney dialysis center, and you can go and do your kidney dialysis free of charge. And so, what are we doing? We are trying to prevent especially non-communicable diseases before they become complicated. Non-communicable diseases have become the heaviest disease burden in Ghana. Breast cancers, cervical cancers, hypertension, strokes, cardiovascular accidents, and renal failure, kidney failure. They become the highest disease burden in Ghana because of the change in our lifestyle. And so one of the aspects of the free primary health care too will be to educate people on what makes you susceptible to non-communicable diseases, how to change your lifestyle. I mean, if you are the kind of person who likes eating heavy foods, you are not physically active, you are sitting in one place, and yet when they give you your fufu or banku, you say it's too small, you want a big bowl of fufu, and you want to eat it every day. Sometimes you eat it at night before you go and sleep. All those dietary changes you'll be educated on. Please, by 7 o'clock, eat your dinner and don't eat again. If you are hungry, just take some cup of tea or something. Don't eat any heavy food. Banku in the evening, you come from work in the evening, and then your poor wife is tired. Come and do banku, come and stir banku for me at 10 o'clock in the night. Why? So, an aspect of the free primary health care will be education on how to maintain a decent lifestyle. Our fathers and co used to eat banku and fufu late in the night, but they were physically active. They used to go to the farm and they expended energy. Now we don't do any physical activity. You wake up in the morning, no exercise, you eat breakfast. They used to walk to the farm. You go and take your car, drive to work. When you go to work, you go and sit behind the desk from 8 to 5. You close, you take your car again, you come home. And when you come home, you say, where is my banku? What physical activity did you do to deserve banku? You know, so change of lifestyle will be part of the educational activity of the free primary health care. And then we're going to have a category of them. The health professionals in our CHIPS compounds and other places would be the ones who would be the primary administrators of the free primary health care. But we're going to have a category that we call health volunteers. This will include national service people. It will include nurses and other paramedics who have finished school and are waiting for posting. We'll deploy them in the free primary health care service until when it's time for posting. For those who volunteer and take part in the free primary health care, when it's time for posting, we'll give them the sugar and all that. They have a scale. They will measure to see if you are too heavy. That is, they call it the body mass index. Your height and your weight must correspond. If you are not too tall and you are too fat, it means, no, sorry, I'm not trying to shame short people. But I'm just saying the truth. There's something called body mass index. They take your weight as a proportion of your height. So if you are shorter, you must be leaner. If you are taller, you can be heavier, but you must also be within a certain body mass index, so that you avoid any of these non-communicable diseases. And so they'll have those weighing scales. You sit on it, they'll tell you you are overweight by this amount. So cut down your banku a bit so that your weight can come down. Okay, the minister has brought a sample of the bag. It has everything in it. It's got the scale for measuring if you are overweight. It's got the thermometer to take your temperature. It's got the blood glucose monitor. It's got the stethoscope to listen if you have any respiratory illness. It's got the sphygmanometer. They call it sphig for measuring blood pressure. And then there's a torchlight in the night if they have to work. Then they have a raincoat in case it's raining. And then the blood glucose strips or whatever they call them. Okay, so they'll be equipped with this, and they'll come to your community. And so we also have the health kiosks. So in areas where we don't have CHIPS compounds, we'll come and put the health kiosk. The health kiosk is like a CHIPS compound. It's a containerized CHIPS compound. And so we'll put them in areas that are underserved. Now, as the minister said, we're starting with 150 districts. And we'll be very careful in selecting the 150 districts. These are districts that are underserved when it comes to healthcare. So we are prioritizing them in the beginning of implementation. So those districts have been selected in all the regions. Greater Accra has some districts in there. Savannah, I think Savannah has all the districts, except Damango. Yeah, the capital has a very good hospital there. But all the other districts have been selected. So depending on the underserved areas, we've selected them to start. But the rest of the districts will join next year. And so we'll finish the complete rollout in all the districts by 2028. But this year we're starting with 150, and we'll continue with the rest after that. They'll have motorcycles, and so they can ride and go into the communities. And then we're going to complement this with mobile health clinics. In my first incarnation as president, we had them, we called them Onuado, and unfortunately they were abandoned after we left office. So we're going to restart the Onuado program, and we will deploy the mobile clinics to the districts. And so they will complement the work of the free primary health care. They would go into the districts, they would have outpatients department, everything, and they'll provide treatments at that level. So these are this is what it has to do with the free primary health care. I hope I've complimented the minister by trying to explain it as well as I understand it. If I made any mistake, it's my fault. But I thank you all very much, and God richly bless us. And so, policeman, get ready. It is my honor and privilege, with the powers vested in me as President of the Republic of Ghana, to officially declare the free primary health care policy duly launched. Thank you. God bless our homeland Ghana and make our nation great and strong. I thank you.
Mr. President, thank you very much for that inspiring address and for officially launching this transformative program. To our viewers across Ghana and beyond, you've just witnessed a defining national moment Please, ladies and gentlemen, please join me in appreciating the President of the Republic once more. We now invite the Chief Executive Officer of the National Health Insurance Authority to deliver the vote of thanks. Let's welcome Dr. Victor Bampo.
Your Excellency, the President of the Republic of Ghana, Honorable Minister for Health, Honorable Ministers of State, Honorable Members of Parliament, Neneme and Naname, distinguished guests, ladies and gentlemen. On behalf of the Honorable Minister for Health and the organizing committee, it is an honor to deliver this vote of thanks at the close of such a historic occasion. Today we've not only witnessed a launch, what we have witnessed is the birth of a promise, and we thank omnipotent God for his power, sovereignty, and faithfulness in all situations. We also say thank you all for being part of this. Ladies and gentlemen, as our elders remind us, the one who climbs a good tree is given a push. Many hands have come together to lift this noble effort, and it is only right that we acknowledge them. First and foremost, Your Excellency, President John Dramani Mahama, we thank you for your vision and leadership. It has been said that the future belongs to those who can see it before it arrives. This initiative is a testament to that foresight, your bold commitment to a healthier and more equitable Ghana. Honorable Minister for Health, Honorable Kwabena Minta Akando, as you know, in our health settings, it takes a skilled midwife to bring life safely into the world. You have served as that steady hand, guiding His Excellency's vision into reality. We are deeply grateful. I cannot finish this section without mentioning the organizing group that spent sleepless days and nights to put this together, led by our Chief Director of the Ministry of Health, the Director for Policy Planning, Monitoring and Evaluation and other directors, the Director General of the Ghana Health Service, his deputy and regional directors and other staff, the Executive Director of the Christian Health Association in Ghana, and other colleagues at the NHIA, and all other people who were involved in this. Thank you very much. To our partners, including the leadership of Parliament and other sectors, development partners, regulators, professional associations, the experts, and all stakeholders who contributed to the design and preparation of this initiative, we say thank you. For us, we say, wisdom is like a baobab tree. No one person can embrace it alone. This achievement belongs to all who contributed their knowledge, time, and commitment. To our traditional leaders, honorable members and stakeholders across all levels, we thank you for your continued partnership. To the media, we appreciate your role in ensuring that this message reaches every Ghanaian. And to our health workers across the country, we say thank you. We know you are the ones who will carry this vision into communities, into homes, and into the everyday lives of our people. Through your hands, this policy will become reality. Ladies and gentlemen, in our culture, we say the one who fetches water does not forget the well. Today, we remember every well from which this effort has drawn strength. Thank you. But beyond all gathered here, we dare to extend this gratitude even further. We speak humbly yet confidently on behalf of generations yet unborn, those who will inherit the benefits of what has been set in motion today, those who will live longer, healthier lives because of the choices we have made now. This is the legacy we are building, and they will be better for it. And so, on behalf of our indefatigable Honorable Minister, the organizing committee, the people of Ghana, and even those generations yet unborn. Thank you very much.
Thank you very much, Dr. Victor Bampu, Chief Executive Officer of the National Health Insurance Authority. To bring this session to a close, I invite the District Imam for the closing prayer. Let's welcome Abdul Qayyum Muzakir, District Imam. I think we can support him with a nice round of applause. He's come to close us out. Thank you. Assalamu alaikum.
In the name of Allah, the most gracious, the most merciful. Heavenly Lord, I stand before you to first and foremost ask you for divine protection over the life, health, and family of His Excellency, the President of the Republic of Ghana, John Dramani Mahama. We ask you, Almighty Allah, to grant the President and his team heavenly wisdom, discernment, and strength to continuously lead our nation with fairness, justice, and integrity. Almighty Allah, we ask you to bless the President with a compassionate heart, to govern and protect the vulnerable. Almighty Allah, help the country by granting the President and those in government accuracy in decisions to positively affect the citizens of this nation. We pray for health and wealth for the chiefs, the clergy, and the nation as a whole. We seek refuge in you from the evil consequences of our actions, and we ask that you forgive us our trespasses. This I pray with thanksgiving to the Almighty Allah. Ameen.
Thank you very much. Ladies and gentlemen, we've come to the end of our event. We'll now observe the departure of the President. He will proceed to the commissioning, but he will first of all greet our traditional leaders on his way to the commissioning of the kiosk and the inspection of the equipment. Mr. President, thank you for your time. The President will greet our traditional leaders and then proceed to the second part of our event, where you commission the health kiosk and inspect the equipment as part of this national launch